Hi, everyone. I would like to say happy Monday, but this is a very not happy Monday. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Monday, August 2nd. I'm here to give you the very sad state of affairs with regard to the COVID-19 pandemic in Mobile County. So today we're reporting a total of 49,335 cases of COVID-19 reported to us. 33 were reported yesterday. Prior to that, it was 346, 462, 510. So again, just the highest numbers that we are seeing since the pandemic came to us in March of 2020. 868 people have died. A total of 6,428 people have been hospitalized with COVID-19 in mobile hospitals, 27 new admissions yesterday. Yesterday and the day before, there were 277 people in the hospital with COVID-19. That is the most we have had, the daily number of hospitalizations since our peak in the winter on January 11th. So on January 11th, we had 276 hospitalizations, and that was the peak, and it started to go down from there. What's happening here is that there is no end in sight. The numbers are continuing to go up. To give you a little bit of an idea about how bad things are, our weekly report came out today as well. So looking at last week, so more cases were reported to us last week than any other week since the pandemic hit Mobile County in March of 2020. There were 3,123 cases reported to us just last week alone. Again, the overwhelming majority, 60% or so of the cases are in people who are 18 to 49 years old. So still hitting those younger populations who have milder illness, thank goodness, but who also have very low vaccination rates. The percent of emergency department visits for COVID-like illness is up to nearly 10%. I mean, it has just, doubled each week for the past couple of weeks. We are still seeing a rather low number of deaths with COVID-19. This is perhaps the best news, and it's because of the vaccine, right? Older people with underlying medical conditions, more than 70% of them have been vaccinated. And this is what the vaccine is supposed to do, protect people from dying. And so it seems, at least so far, we are still seeing a low number of deaths, again, attributed to the effectiveness of the vaccine in those older age groups and people who have underlying medical conditions. The overwhelming majority of cases, the overwhelming majority of hospitalizations are in unvaccinated people. Yes, there are people who are vaccinated who are getting COVID, and even though I say to you it's a rare occurrence, if it happens to you or your friend or your family, it's like it's 100%, right? It's not a 10% risk. If it happens to you, it's 100% risk because it happened to someone that you know or love. But still, we are seeing the overwhelming majority of cases and hospitalizations occurring in people who are unvaccinated. This is also true for deaths, although we have just, less than 10 people dying per week with COVID, which is the only good news I have to tell you today. That other figure that we look at to kind of look at community transmission, or how frequently, how many people are getting COVID, and this is the percent positive. 4 weeks ago, it was down less than 10%. Then it went to 14%, then to 21%, and it is now at over 32%. This is by far the highest number. The last peak, or the two peaks that we saw last summer and last winter, the percent positive didn't get above 20%. And now we are at 32% positive. And there are about 7,000 people getting tested for COVID each week. It's crazy to me that the number of people getting tested for COVID is going way up. And when they come to get tested, we say, hey, you want to get vaccinated while you're here? And many of them say no. It's like, if you are worried enough about COVID to get tested, you should get a vaccine to protect yourself from having to rush to get tested again. Our clinics, we have 2 clinics that are providing testing Monday through Friday. Walk in, we don't charge anybody for testing. It's at no cost, and maybe that's why we're starting just to see crazy numbers of people coming in to get tested. People, when you go get tested, get a vaccine. And also, if we look at the rate of COVID for the last 14 days, again, we adjust this. Look at this map. It's the highest rates of COVID transmission that we have seen in this entire pandemic. So, people are asking me things like, when's there going to be another state of emergency? Why aren't we closing doors? Why isn't there a mask mandate? Because we have a vaccine. We have a really good vaccine that will reduce the numbers of transmissions, that will significantly protect against hospitalizations and deaths. We need people to get vaccinated. And because we have such low vaccination rates right now, we also need you to do what CDC is recommending, and that is wear a mask when you're indoors, regardless of if you're vaccinated or not. Consider layering on those prevention measures. Wear a mask, distance, stay at home, don't go to crowded places. So lots that we can do, not being forced, not being mandated, but because we know it's the right thing. Even in late spring, in May, when people were saying, let's celebrate, let's have festivals, let's have parades, public health was saying it's not over yet. Yes, things are getting better, but we know what it takes to slow transmission. And we need everyone, getting on board with putting those measures back into place. Okay, a couple other things, just some information that's been updated. I just wanted to remind folks what it means if you're fully vaccinated. Okay, so if you're fully vaccinated, we used to, back in May and June, we said go back around, go about your life as it was pre-COVID. But that's when we had 3 and 4% positive tests, and we had 10 or 12 people in the hospital, right? We're not there anymore. So now we're having to go back to saying you need to layer, and even if you're fully vaccinated, if you're indoors, wear a mask. Consider, if you are fully vaccinated but you have an underlying medical condition or you're immunocompromised for some reason, consider wearing a mask all of the time and distancing. Also, now that transmission is so rampant, and some other information that we're learning about the ability of people who are fully vaccinated to still carry virus, so they could potentially, infect others. What we want you to do is, if you are exposed, if you're fully vaccinated but you've been exposed to someone with COVID, you still don't have to quarantine, so you don't have to go home for 2 weeks, but we would really like for you to wear a mask for those 2 weeks, just in case you have, you are able to spread COVID even though you have no symptoms of COVID. So that's something that is also very prudent at this point if you are fully vaccinated and you are exposed to someone with COVID. Okay, a couple other things. The Alabama Department of Public Health updated guidance for K through 12 schools, and they published a new, they're not calling it a toolkit anymore, but back to school guidance. And it mostly says we are adopting the CDC toolkit, but there are some other things, some graphics and some other sort of cliff notes that you can quickly go to look at that applies again in the K through 12 setting. So this is sort of a Alabama adaptation of the CDC guidance for K through 12 schools. So go check it out. It's on the ADPH website. So I just want to read a sentence from the press release on the K through 12. It says, Dr. Harris, who's our state health officer, for those who are eligible, vaccination remains our most potent strategy for preventing disease among students, faculty, and staff. And vaccination also eliminates the need for quarantine among close contacts in our schools. Other mitigation strategies such as face coverings, distancing, and hygiene are also important, especially in the communities that are experiencing high levels of COVID-19 transmission like Mobile County. So just to remember, we want kids to be in school. So if they're eligible to be vaccinated, please vaccinate them, because if there is an exposure event at their school, the ones who are vaccinated will be able to remain in school. If you are not vaccinated and exposed, then you could potentially be excluded from school. And also wearing a mask and distancing and washing hands, that sort of thing, still super, super important. Another thing, talking about kids in schools, CDC released a report last week about the safety of the COVID-19 vaccine in adolescents aged 12 to 17 years. Again, just saying that the COVID vaccine is highly effective and is very safe in children 12 to 17, and that while there is a rare chance of myocarditis, that the Advisory Committee on Immunization Practices conducted a risk-benefit assessment and continues to recommend Pfizer vaccine for all persons at least 12 years old. That the benefit of the vaccine far outweighs the risk of myocarditis following vaccination. Again, remember that there have been reports out there of adolescents and also adults who got COVID and had problems with their heart. So the overwhelming majority of events were mild in these millions of kids who were vaccinated. I was going to try to find this sentence right here. Among 8.9 million adolescents vaccinated during the study period, the adverse events reporting system were received for approximately 1 per 1,000 vaccinees, and among those, 90% were for non-serious conditions. Syncope or fainting was among the event most commonly reported in this age group and is common among adolescents after any vaccination. So again, lots of information. Nearly 9 million adolescents between the ages of 12 and 17, showing that the vaccine is very safe in those age groups. So that's great news. All right, there are some questions and I will try to answer them. Let's see, someone wanting to know if we can provide information on COVID transmission in restaurants. Let's see. So yes, the health department receives reports of outbreaks in all kinds of settings. Restaurants are not immune to outbreaks among staff and outbreaks among patrons. Again, there are no mandatory mask mandates, so it is up to individual businesses to encourage their staff to be vaccinated and to require or recommend masking appropriately for their staff. It's also up to businesses to decide if they want to require masks for their patrons. That is not something that will be mandated, but it is up to the businesses to decide. We do hear about clusters of illness, in following parties, events, church, schools, camps, you name it, it's happening everywhere. What is the department's response on this record number of weekly cases? I think you can probably tell by my opening remarks that it is a very sad day for me in Mobile County to see so many cases occurring around the county and so few people willing to get vaccinated. What is the role of the Delta variant? Nearly all, greater than 80%, maybe higher, of the sequences that we look at in Mobile County on a weekly basis, by now, they're nearly all the Delta variant. And I think nationally, I heard that Greater than 80% of all sequences are the Delta variant. We are still seeing some alpha variants, some gamma variants, but we almost never see the parent strain anymore. Someone asking about the percent positivity. Last week it was 31%. This week it's, over 32%. That 1 in 3 people who are tested test positive for COVID-19. Yes, we are seeing an increase in the amount of testing, but this is not what's contributing to this alarming and enormous increase in the percent positivity. It speaks directly to the transmission that is happening around our county. Someone asking about the weekly report, is this the highest we've seen? Yes, last week we saw the highest weekly number of cases reported since the COVID-19 pandemic affected us on March 19th of 2020 when our first case was reported in a Mobile resident. The daily number of hospitalizations that we saw yesterday, we've not seen that since the peak on January 11th during our winter wave. And right now the hospitalizations are rising. We're not at a peak yet. It will continue to rise. And this is really an unfortunate situation, and one that is almost completely attributable to people who are not vaccinated getting COVID. And also, we saw the 32%, another record high percent positive. So that is disappointing and very concerning indeed, particularly since we are very close to the start of the school season. All right. Someone said, a media outlet, a print media outlet is asking about a recent decline in cases. I'm not seeing what you're seeing with a recent decline. We sometimes see them taper off on the weekend and then jump back up at the beginning of the week. If today in our clinic is any indication, about 30 minutes ago, I got a text message from the clinic administrator downstairs saying that they are, not going to be able to register additional people to get COVID tested today because they had 58 people waiting in line to get tested for COVID. So we will probably break a record today for COVID testing. It's just kind of a pattern that we see, that people, as it gets closer to the weekend, we see fewer and tests. And then once the weekend is over, we see an enormous increase in people wanting to get tested. I think they have some sort of regret, right? That they maybe, are naughty on the weekend and they're around people and maybe they get a little nervous and so they go and get tested the beginning of the week. All right, here are some questions from Facebook. I've read through these and they have a rather a tone to them that I have not seen in a while from some of our Facebook questions. Sort of a very, what are you going to do about this tone? And well, we've been trying for, many, many months now, 16 months to say, wear a mask, distance, wash your hands until we get a vaccine. And then when we get a vaccine, get vaccinated. So that's what we've been doing about it. That's what we will continue doing about it, is to try to, compel people to get a vaccine and to do their part to try to slow the pandemic. I suspect that things are going to continue to get worse. I have been taking it very seriously. When I talk to people about it, I am always very serious. Concerned about the people who aren't getting vaccinated, including some members of my own family. Concerned about the start of school with a mask optional situation for in-person learning. Concerned about parents that, won't vaccinate themselves or their children and are going to send their kids into situations that are going to be challenging, to camps. And we need in-person learning, but we need to sort of control some situations that we can, and have kids get vaccinated and wear a mask, and have your families vaccinated. People who are less than 12, they don't have a choice. Their only protections are community herd immunity, a community around them, a family around them that is vaccinated and wearing a mask when they're in school and when they are in social settings outside of the home. Let's see, someone asking which medical facilities have the highest vaccinated employee rates. So CMS has been talking, not recently, but back in the spring, we're talking about requiring hospitals to publish vaccination rates. As you can imagine, that did not go over very well. So to my knowledge, hospital vaccination rates are not made available to the public unless the hospitals do it themselves. There are published vaccination rates for nursing homes. That has been required, I think, since June 13th. So you can find that information on the CDC website for nursing homes. The vaccination coverage is required, but not for hospitals as far as I know. Someone asking if their oncologist prescribes a booster dose, would it be available? So right now, there are no FDA authorizations for a third dose or a booster dose, the second dose of J&J. If your oncologist decided to vaccinate you with a booster dose, that would be an off-label use. That's between you and your provider. Right now, there are no imminent recommendations or authorizations, that I know of from FDA regarding a secondary dose or a booster to your primary dose. There are pieces of data coming out from other parts of the world, and some coming out from the manufacturer, from Pfizer themselves. And so CDC is looking at all the available data along with FDA, and so far there are no imminent announcements on the authorization of a booster. Someone asking, I guess this is more of a statement, if cases are going up, hospitals are getting full, when are we going to have a state of emergency? It's unlikely. The governor is going to declare a state of emergency. She is the only one that can do that. Also, everyone is conducting business as usual, from restaurants to shop. What other measures need to be put in place to reduce the exposure? Again, vaccine is your best and frontline response, and then masking and distancing. That's how you keep yourself safe. That's how restaurants and businesses and schools and offices can keep themselves safe. But it appears that there are many people out there who choose just to ignore those recommendations and instead are contributing to the wildfire of COVID that is burning through our community. All right, can I please repeat that fully vaccinated people that are exposed are exempt? So yes, if you are fully vaccinated and you are exposed to someone with COVID, you are exempt from quarantining at home for 14 days. It is recommended that you wear a mask during those 14 days so that you don't unintentionally infect someone else if you contracted COVID, but you were asymptomatic because you were protected from the vaccine. Okay.
How soon after you've been got COVID can you get a vaccine?
So the question is, how soon after getting COVID can you get vaccinated? So in the 10 days after you have COVID, we want you to stay at home. And as soon as you have waited 10 days and you're asymptomatic, you can get a vaccine. Anything else? All right, I think that's it. So sorry for just being a little bit frustrated and disappointed today. We will get through this together. We'll get through it better if you'll get vaccinated. We need to keep hospitals from filling up, because even though a COVID hospitalization right now is not as severe as it was back in the winter, what happens is if our hospitals beds are full, then we start seeing our emergency departments fill up. And if our emergency department beds are full, then ambulances can't offload patients into emergency departments. So their unit has to stay at the hospital with the person on the unit, which means that there are fewer hospitals to go, to go help someone who truly needs emergency care. And then what happens then is the fire department has to go, and they can't transfer patients because they're having to care for the person at home until an ambulance can become free. So then the consequence is that people who have heart attacks and accidents and car accidents or accidents in their home, or who get other conditions, can't get to the hospital. So it's just an overtaxing of our hospital, our entire healthcare system, actually, that could be avoided with higher vaccination rates in our community. So please, even if you don't think COVID will impact you, think about the impact of an overloaded healthcare system on you and your family. When you need healthcare, you expect for it to be there. But filling our hospitals and our emergency departments and our ambulances with COVID patients means that fewer of those emergency services are going to be available for other things that happen every day. So I will leave you with that thought, and we'll talk again tomorrow. Stay safe, everyone.